Like the first tumor you have written is chondroblastoma. The most common region or most common bone to be affected by chondroblastoma is a proximal humerus. Similarly, for osteoclastoma GCT, the most common bone to be affected is distal femur, then proximal tibia. If you talk about that in the upper limb, what is the most common bone to be affected by GCT? It will be distal radius. Alright. So distal radius is the most common bone to be affected by GCT in the upper limb. So these are the most common bones to be affected by this particular tumor. As far as osteosarcoma is concerned, for osteosarcoma, it is again distal femur, then proximal tibia. But in case of upper limb, the most common bone to be affected by osteosarcoma in upper limb is the proximal humerus. Alright, so this proximal humerus is the most common bone to be affected by osteosarcoma in the upper limb. So this is for osteoclastoma and this one is for osteosarcoma. Next comes the chondrosarcoma. In case of chondrosarcoma, it is the pelvis which is the most common site to be affected. For osteochondroma, it is again distal femur and proximal tibia. These are the two most common sites to be affected. For osteoblastoma, it is the vertebrae, that means thoracic vertebrae, the most common site to be affected. For simple bone cyst, it is the proximal end of the humerus, the most common site. For simple bone cyst, it is proximal humerus, while for aneurysmal bone cyst, it is again distal femur and proximal tibia. As far as for enchondroma is concerned, so enchondroma, the most common site to be affected are the smaller bones in hand. So it is the tumor primarily affecting the small bones in hand. You know, the metacarpals and the phalanges are the most common site to be affected by enchondromatous lesion. So this is about the metaphyseal tumor that you have to remember. These are the most common bone to be affected by epiphyseal and the metaphyseal tumor. Now, Ewing sarcoma. The most common bone to be affected by Ewing sarcoma is the femur. And second most common bone to be affected is the tibia. So femur and tibia are the most common bones. For multiple myeloma, it is the lumbar vertebrae, which is the most common site. For osteoid osteoma, it is femur, which is the most common site to be affected. For adamantinoma, it is tibia, because almost 85% of the cases of adamantinoma involve the tibia. Tibia is the most common site to be affected. And finally, the fibrous dysplasia, it is femur and craniofacial bones. So femur and craniofacial bones are the most common site to be affected by fibrous dysplasia. So with this, we have completed two formulations of the tables. The first one is the location of the tumor, epiphyseal, metaphyseal and diaphyseal. And the second one is the most common bone to be affected by that particular tumor. Alright, it will help you out in ruling out the differentials which are provided to you in the options. When we will practice the question, you will come to know that how easy it is to rule out the other options. Then, so with this, we have covered this table also, that what are the most common bones to be affected by that tumor. Now, the radio-resistant tumors. That means the radiotherapy, primary radiotherapy is not used for management of these tumors in order to limit the progression of the tumor. It could just be used as a palliative therapy in the management of those tumors which are radio-resistant. So what are radio-resistant tumors that you have to remember? The first one is osteosarcoma. You know, conventional osteosarcoma management does not incorporate radiotherapy. Osteosarcoma usually are managed by radiotherapy for its palliative management. Alright, otherwise chemotherapy, both in the form of neoadjuvant as well as adjuvant, along with the surgical excision, is considered to be the primary mode of management for osteosarcomatous lesion. Similarly, chondrosarcoma. So chondrosarcoma is also radio-resistant. Apart from this, the fibrosarcoma as well as liposarcoma, both of them are radio-resistant. Then synovial cell sarcoma is radio-resistant. And secondaries of renal cell carcinoma. You know, the renal cell carcinoma, which has got the tendency of metastasizing to involve the bone, they are also radio-resistant, which are responsible for causing the lytic lesions in the bone. Alright. And examples are so on. But most importantly, what you have to remember that osteosarcoma and chondrosarcoma are primary radio-resistant tumors of the bones. So this is something that you have to remember in the form of a table. Then most common tumors. This is a kind of a table where they can ask you that although these kind of the questions today are obsolete, that most common tumor of the bone. If I, for example, write that which of the following is the most common tumor of bone. So the most common tumor overall are the secondaries. That means it is not the primary tumor of the bone which is most common. Overall, the incidence of the most common tumor is because of the secondaries. But if the language of the question is changed to that which of the following is the most common primary tumor of bone. So the most common primary tumor of the bone is multiple myeloma. All right. But all of you are aware of the fact that multiple myeloma is a plasma cell disorder. It is not an osteoid kind of a bone formation. It is not the cartilaginous product of the bone tumor. It is a plasma cell disorder, which is no doubt originating from the bone. So if you want to ask that which of the following is the most common tumor of non-hematopoietic origin, that means most common primary tumor of non-hematopoietic origin, then it will be osteosarcoma. So there are different languages the question can be asked, like which of the following is the most common primary tumor of the long bone, because long bone primary tumor is osteosarcoma, most common. And if osteosarcoma is not there in the option, then you have to go for Ewing sarcoma, because Ewing sarcoma is the second most common answer for that particular question. Now, the common thing which is related to all these four tumors, that means secondaries, multiple myeloma, osteosarcoma, as well as Ewing sarcoma, that all of them are malignant tumors. So it can lead to another question, that which of the following is the most common benign tumor of bone. So the most common benign tumor of the bone is osteochondroma. Previously they used to ask that which of the following is the most common true benign tumor of the bone, which one of the following is the most common benign tumor of the bone. So osteochondroma previously was considered to be a developmental abnormality. It was not considered to be a true benign tumor, and osteoid osteoma was the answer for that true benign tumor. But today osteochondroma is considered to be a true benign tumor of the bone. So for that, any question, if they ask which of the following is the most common tumor of the bone benign, answer for that question remains osteochondroma, because it is a true benign tumor of the bone. It is no more a developmental abnormality. Alright. So this is another very important table, which today they are not asking for obvious reasons. Then comes the age predilection. A very helpful table for you to at least rule out one or two options from the question just based on the age which is provided to you in the question. So age predilection, for example, if they have given you 0 to 10 years of age, for example, in a question you are getting the age group of around 8 years, 10 years, 9 years. All right. So what are the tumors that you have to consider? So the tumors that you have to think of are the Ewing sarcoma, simple bone cyst, and polyostotic fibrous dysplasia. All right. So these are the tumors that you have to think about. If, for example, chondrosarcoma is present in a question or in the options where the age is provided to you as 8 years of age, then obviously you have to rule out this chondrosarcoma. It cannot be there in the 8 years of age. So for 10 to 20 years of age, the tumor that you have to think about are the osteosarcoma, then osteochondroma, then chondroblastoma, then aneurysmal bone cyst, and monoostotic fibrous dysplasia. Although this can happen in any of the age group, but this is how you can delineate or distinguish to some extent. All right. So if the age group is mentioned, because majority of the time, what happens, this second decade of life is utilized by the examiner in asking the question related to osteosarcoma. Okay. Then 20 to 40 years of age, it is GCT, most of the time it is the tumor of a skeletally mature individual. So beyond 20 years of age, it is giant cell tumor. Then 40 to 60 years of age, this is the age group for chondrosarcoma. As I told you that if for the age group which is mentioned as 10, 12, 20, chondrosarcoma can never be the answer for that particular question, because this is the age group for its modal peak. 40 to 60 years of age for chondrosarcoma as well as for secondary osteosarcoma. All right. Chondrosarcoma and secondary osteosarcoma. You will come to know what exactly is secondary osteosarcoma. Secondary osteosarcoma is because of the pre-existing condition in the bone. For example, the patient was having a Paget disease. It got converted into osteosarcomatous condition. Patient was having GCT. It got converted into osteosarcoma. Patient was exposed to chronic radiation. It got converted into osteosarcoma. So that is secondary osteosarcoma. When we are going to have a discussion on osteosarcoma, you will realize that it is actually having a bimodal incidence, bimodal peak incidence. And finally, in elderly, that means beyond 60 years of age, it is multiple myeloma. So this table is to some extent going to help you in ruling out the options. Like if the option of 20 years of age, for example, if the option of 12 years of age given, and Ewing sarcoma, osteosarcoma, both of them are kept in the options. So you cannot rule out Ewing sarcoma, you cannot rule out osteosarcoma, but if multiple myeloma is kept in that option, then obviously you will rule out multiple myeloma. If chondrosarcoma is kept there in the option, you will rule out chondrosarcoma. So this is how it will be helping you in making the certain diagnosis, in reaching the certain diagnosis. So what are the tables that we have already covered? The first one was the location of the tumor, epiphyseal, metaphyseal, diaphyseal. Second is the most common bone to be affected by the tumors which were introduced to you. Third is the radio-resistant tumors of the bone. Fourth, most common tumors of the bone overall most common tumors of the bone. And the fifth one is the age predilection. And finally, the most important table for today, for this particular, for your examination and for this particular topic, is the named eponymous X-ray appearances. All right. So let's have a discussion on the X-ray appearances. But before that, so most common bones to be affected, we have already talked about. Radio-resistant tumors we have talked about. Now comes the X-ray appearances. Now under the heading of X-ray appearances, the first is Codman triangle, then sunburst appearance, then rising sun appearance, and hair on end appearance. All these X-ray findings are the feature of osteosarcoma. Then onion peel appearance. Now this onion peel appearance is the feature for Ewing sarcoma. Now is the time to have a discussion on that what are the reasons for these appearances, or what you have to remember out of these appearances. Means what is the basic reason for these appearances in particular.